Hey, my name is Sumit Jindal. I am a ophthalmologist and oculoplastic surgeon. So my specialties are in anterior segment surgery. That means cataract surgery, glaucoma, pretty much most comprehensive eye issues, as well as fellowship training and subspecialty training in eyelid and facial cosmetic and reconstructive surgery. And I wanted to make a quick video because likely you're coming in for a referral for a Stye or a Chalazion or a hordeolum or some sort of inflamed bump on your eye that may be causing you some issues, and your doc wants to send us over for it and potentially have a procedure for it. So I wanted to make a short video just to, explain what that process looks like in our clinic, especially when you're referred over from another eye care provider. So a Stye, hordeolum, Chalazion, these are all kind of issues that usually happen on the upper or lower eyelid, and it means typically that an oil gland got backed up. It created a small little microinfection in that area. Maybe it got really big and red at some point. Maybe it's kind of been sitting there for a long time and not going away. Whenever a patient comes in, we still do a relatively thorough eye workup, especially based on your ocular history and your periocular history. And so that means, we're just going to do some basic tests. So sometimes we still look at the back of your eye just because we are, surgical ophthalmologists, and we want to make sure your eyes are in good health and nothing that we plan on doing will affect anything else that you may already have going on. The options for treating these typically starts off with medical management, which you may have already been doing. That can mean a combination of oral antibiotics. It may mean a drop or an ointment that has an antibiotic and or steroid in it. Sometimes it means a steroid injection into that area. And ultimately, the last resort really is to cut into that lesion and drain it. And that is a relatively simple outpatient procedure, but we only want to cut into a Stye or Chalazion or any of those sorts of bumps if it's ready for that to happen and if we've exhausted the other options for it. So if you haven't started on any medical therapy yet, or if there's another medical therapy that could be beneficial for you prior to having this incised and drained, then we will start you on it. And again, that could be an oral pill, that could be a topical antibiotic steroid ointment, and that could also mean a small quick injection into that area that can help in many cases get rid of these without having to do any sort of procedure on it. If you do have to do a procedure on it, again, we do the majority of those in our clinic. The patient's awake. You feel a pinch and a burn in the area that we're numbing. And then for a lot of these, we are actually flipping the eyelid on its inside to get to that bump and drain it. Sometimes we have to go from the outside as well. And these can be stubborn, and sometimes we have to drain them 2 or 3 times in patients where it keeps coming back, or if it was a very large area that's been there for a long time. We also have the option of doing these at a surgery center where you can be placed under IV sedation, so that if you have any anxiety around the procedure or and would rather be more so asleep and not remember it happening, that is an option as well. The doctors and surgeons you might see at your visit could include me. It could include Dr. Vinod Jindal, who's my father. It could include Dr. Prabhakaran, who's another comprehensive ophthalmologist with training in oculoplastic surgery. And that can vary appointment to appointment based on what works best for your timing and availability to come into our clinics that are located in the Brier Creek area of Raleigh and as well as Oxford, North Carolina. When you come to your appointment, all you need to do is bring your medical insurance information and we'll take care of the rest. Our goal at the end of the day is to work with your referring eye care provider to make sure you get the best care possible that's most safe and effective for you. And of course, also when it comes to insurance payments, we're going to make sure we get everything properly approved prior to doing anything on you so that you don't get hit with any hidden fees or surprise bills in the mail. And sometimes insurance companies can be tough to deal with, which can mean that on the first day that we see you, we may not be able to do a procedure unless it's considered an emergency by an insurance company, which there's a very small list of procedures that really qualify for that, but sometimes we can get lucky and push things through faster. In any case, we're going to do what is going to ultimately work out best for you, both logistically, financially, and of course, most importantly, for your overall eyelid and eye health. And if you think of any other questions before your appointment, feel free to reach out first, but we'll make sure everything is addressed for you at that appointment, and if you do need to have a scheduled procedure between that point in time. We look forward to meeting you and being a part of your care and taking good care of you.